আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহ। আজকে অনেক দিন পর আমরা মাইকোলজির উপরে একটা ক্লাস নেব। বিসমিল্লাহির রহমানির রহিম। বিসমিল্লাহির রহমানির রহিম। আসসালাতু ওয়াসসালামু আলা সাইয়্যিদিল আমবিয়া ওয়াল মুরসালিন। রব্বি জিদনি ইলমা রব্বি ইশরাহ লি সাদরি ওয়া ইয়াসসির লি আমরি ওয়াহলুল উকদাতাম মিন লিসানি ইয়াফকাহু কওলি। আজকে আমাদের আলোচ্য বিষয় হলো ফাঙ্গাই অফ মেডিকেল ইম্পর্টেন্স। এতে আমরা আলোচনা করব what are the types of fungal pathogens, classification and definition of fungal disease, major fungal infections, risk factors for opportunistic mycosis, and laboratory diagnostic aspect. The questions after the review questions will be: what is mycology? Name 5 important fungi with the disease they produce. Name dermatophytes. How will you diagnose in the lab? Role of potassium hydroxide. What are the morphological forms of fungi? Give example of mold, yeast, yeast-like and dimorphic fungi. What type of fungi is candida? What disease they produce? How will you diagnose in the lab? The branch of medical science which deals with the fungus are known as mycology. Morphologically, the fungus can be of 3 types. One is mold, which consists of some fungal hyphae and mycelium. Yeast are single cell. It's like a little smaller than the RBC. These are called yeast, and some yeast have budding. They are called yeast-like. And dimorphic fungus are those fungus which have 2 phases of growth. In one environment, they remain as mold. In another environment, they remain as yeast. And you can see the examples. Pure yeast is only one fungus, that is Cryptococcus neoformans. And yeast-like fungus are Candida and Malassezia. Molds, most of the fungus are molds. Aspergillosis, Dermatophytes, Mucor species, Rhizopas, all other fungus are molds. And few funguses, they remain in 2 forms, molds as well as yeast. They are Histoplasma capsulatum, Coccidioides immitis, Blastomyces dermatitidis, and Sportrix shinki. At 25 degrees centigrade, they remain as mold, that is in the environment, and at 37 degrees centigrade or in the body, they remain as yeast. So, বডিতে যারা যে ইস্ট আকারে থাকে, এটা মনে রাখার জন্য আমরা এটা বলি, যেহেতু বডিতে খাবার দাবার সব রেডি, তাদের হাত পা ছড়াতে হয় না। হাত পা মানে হলো এখানে হাইফি এবং মাইসেলিয়াম। সো ইন দ্য বডি দে রিমেইন অ্যাজ ইস্ট, বাপের হোটেলে খাওয়ার মতো। সো বেসিক গ্রোথ ফর্মস আর মোল্ড, যেটা আমরা বলেছি, filamentous multi-nucleate branching hyphae, and the hyphae form the mycelium. This is mold form. And unicellular yeast form, single cell fungus. From a single cell, budding can occur. Typical example is Cryptococcus, and budding yeast is Candida. So dimorphism, we have said that some fungus can remain in 2 forms in 2 different temperatures. Say, for example, Histoplasma capsulated in the body, they remain at 37 degrees centigrade, they remain as yeast form, and in the environment at 25 degrees centigrade, they remain as mold form with branches. And in the growth condition also, in seborrhous agar at 25 degrees centigrade, they remain mold form, but in a rich media, brain heart infusion agar with 5% blood at 37 degrees centigrade, they remain as yeast form. Where the pathogenic fungi, they remain. Many of them remain in the soil. Example, Cocci dioricimitis, keratinophilic fungi, and dermatophytes. Some of the dermatophytes, they remain in the soil. Histoplasma associated, they remains in the soil associated with bird and bat feces. Cryptococcus neoformans, they remain in the soil associated with pigeon feces. And Aspergillosis, Candida albicans, they remain Aspergillus and mucoral, they remain soil and vegetable matter. Only fungus that remain in the human body as normal flora is Candida albicans and Malassezia species. What are the types of fungal diseases? The diseases caused by fungus depends on 3 types. Some due to toxin, mycotoxicosis, some due to allergy, asthma, allergic bronchopulmonary disease, which are IgE and IgG mediated, and most of them are due to colonization and invasion. For example, superficial, cutaneous, subcutaneous mycosis, deep-seated or disseminated opportunistic mycosis, and endemic mycosis. So common fungal diseases are superficial or cutaneous mycosis, Tinea versicolor, and Dermatophytosis, also called Tinea. Opportunistic mycosis, they are candidiasis, cryptococcosis, pneumocystosis, aspergillosis, and zygomycosis. True or endemic mycosis, Cocci, Diadomycosis, and histoplasmosis. Let us discuss about superficial mycosis. This is Tinea versicolor, also known as Pyteriasis. Some hypo and hyperpigmented patches are found, especially on the back. And this they can be diagnosed by scraping the tissue, superficial tissue, and examine with potassium hydroxide or cotton blue mount, and simple potassium hydroxide preparation also. It can be seen there are yeast and some yeast-like structures. Skin scrapings from the case of Tinea versicolor, and typical structure is meatball appearance, spaghetti meatball appearance. This is easy to diagnose. Dermatophytosis is a common condition, and it is caused by dermatophytes, which have affinity for dermis or keratinized structure of the body, which are found in the skin, hair, and nail. These dermatophytes, they are keratinophilic fungi. They colonize in the cornea. The arthrospores adhere to the keratinocytes. They germinate there and invade. And typical lesion is like a ringworm. That's why it was previously called as tinea capitis, depending on the site of infection, tinea capitis, tinea corporis, and such. Their main symptom is itching. So there are 3 genus which belongs to dermatophytes. They are Microsporum, Trichophyton, and Epidermophyton. They infect keratinized tissue. They produce keratinase enzyme. They colonize stratum corneum, and severity of the disease depends upon species of staining group, and sometimes allergic and inflammatory lesions occur. Their diagnosis is also very easy. The skin scraping is taken and it is dissolved in potassium hydroxide, which leads to fungal hyphae. It can also be cultured in several dextrose agar media with antibiotic, also known as dermatophyte agar media, chloromphenical and hypochlorite. And you see skin scraping or nail clipping or epilated hairs, they show a structure like this. These are the hyphae, segmented hyphae. Direct microscopy. What is the role of potassium hydroxide? Actually, potassium hydroxide do not stain it. It does dissolve the keratin layer. So role of potassium hydroxide is to dissolve the keratin layer. Candidiasis is another common fungal disease, and this is the only fungus that can remain in the body as normal flora of the genital tract. And the clinical manifestations may be localized to mouth, throat, skin, vagina, or GI tract, and they become systemic or when there is immunosuppression, for example, in HIV/AIDS patient. The major Candida species that are pathogenic are Candida albicans, Candida parapsilosis, and Candida tropicalis. Other yeast or yeast-like are Malassezia furor and Cryptococcus neoformis. This is a picture of oropharyngeal candidiasis or oral thrush, and in case of immunosuppressed patient, leukemia, HIV, diabetes mellitus, sometimes it causes systemic infection. This is nappy thrush and can go to the mouth area. And vulvovaginal candidiasis, this is important cause, especially in women with risk factors like diabetes mellitus and with oral pills. In this condition is characterized by card-like milky vaginal discharge, often associated with broad-spectrum antibiotics in the third trimester of pregnancy, low vaginal pH, and diabetes mellitus. There can be diagnosed easily. High vaginal swab is taken and examined by direct microscopy with potassium hydroxide, or gram stain smear reveals yeast with pseudohyphae, very easy. Cryptococcosis is a chronic subacute to acute pulmonary, systemic, or meningitic disease. It is initiated by inhalation of the fungus. Primary pulmonary infections have no diagnostic symptom and are usually subclinical. On dissemination of the fungus, usually shows a predilection for the central nervous system, and distribution is worldwide. Cryptococcus neoformis, natural habitat, as we have said, associated with pigeon faces. Laboratory diagnosis, there are both microscopic as well as immunological tests. Microscopic, encapsulated each cell in the CSF, tissue fluid, or bronchoalveolar lavage and urine. An antigen can be detected by immunological test, capsular pulsation. Pneumocystosis is a fungus that causes pneumonia in immunocompromised patients, especially with AIDS. It attacks the interstitial tissue of the lung, causing marked thickening of the alveolar septum and alveoli, leading to significant hypoxia. And treatment is by trimethoprim sulfamether, and it is diagnosed by special staining known as methenamine silver, and typical cyst walls are present. Aspergillosis is a spectrum of disease of humans, and it spectrum varies. It causes mycotoxicosis due to ingestion of contaminated food, allergy and sequelae to the presence of conidia or transient growth of microorganism in the body orifices. It can colonize without extension in a preformed cavity and debilitated tissues, and sometimes it causes invasive inflammatory granulomatous and necrotizing disease of the lung, similar to tuberculosis, pulmonary tuberculosis. Its distribution is worldwide. Common is Aspergillus fumigatus. Besides this, there are Aspergillus niger, Aspergillus flavus, and its life cycle started with the inhalation of spore. This spore germinates. Then there is a hypha, elongation and branching, and masses of hyphae. It produces the fungus ball. What are the conditions for risk factors for invasive aspergillosis? Number one condition is prolonged neutropenia, high doses corticosteroid therapy for several weeks of duration, organ transplant recipients receiving immunosuppression, and chronic granulomatous disease. Laboratory diagnosis is easy. Fresh sputum, bronchoalveolar lavage or biopsy can be taken, and if digested in 10% potassium hydroxide, just you can see the septate hyphae. Lactophenol cotton blue or calcoflower can also be used for better visualization. So I wish you all the best. Thank you very much for patience here.